Okay, let's say, look, guys, it is very important. Ring for indirect hernia, it will be deep. For direct one, it will be superficial. Remember about it. Okay, now I separated the sac. Next my step, I will open it. And I will make the recognition of its content, if it is present. By the way, I can have two situations with content. Three situations with content. Situation number one, absolutely normal content, which is not fused with the sac. Such kind of hernia we call reduced. We can have second situation, absolutely normal. When I say normal, I mean alive. Content, which by dense threads fuse with the sac. Such kind of hernia we call non-reducible. And finally, touch wood, we can have such kind of the content. You can see that content is not alive, strangulated, and we must to make here decision, guys. And decision is not easy. I must to finish my surgery here. I must to make the big laparotomy, usually midline, and inside of peritoneal cavity to push back this intestine to make resection and anastomosis. Only after I will come again to the region to make plastical reconstruction. Believe me, friends, inside of this small incision will be absolutely impossible to make resection and anastomosis. You must make big excess. You can ask me how we can recognize is it alive or not. A lot of signs. For example, peristaltical movement. Alive, have. Non-alive, no. Color. Alive, pink for small intestine, gray for large intestine, black and blue for the mortal intestine. Next, you can say, for example, turgor of the tissues, elasticity. Yeah, normal tissue is elastic. You push, it is come to back. If it is not alive, no. But that is not the final signs. Final sign, it is pulsation of mesenterial vessels. You apply your fingers into the vessels, they back to surface. Yeah. If you feel the pulsation, intestine is alive. If you don't feel, despite the color, smell, I don't know anything else, it is not alive, and you must make resection. Okay, but anyhow, let's imagine that intestine is absolutely normal or it is absent. What I should do? If it is inside, yeah, I will push it to back. What after this? After this, I will suture the neck or ligate it. Suturing is better because it is fixed the needle thread in its place. Then after it, little bit distally to it, I cut the sac and remove. Hernioectomy is performed. I remove the hernia. What after, guys? After I come to the second stage, which we call plastical reconstruction. And you can see in the slides it's written that there are two methods, with the tension, otherwise with the tissues of the own body, or without tension. What does it mean without tension? You use the allotransplantat, which has the mesh form. And you make the plastical reconstruction by mesh. What does it mean, method with tension? The most simple, what you can imagine. From upwards there are muscles, from down there are ligaments, between them 1.5 2 centimeters, tense them to down to make maximal force for the inguinal space. Read please the techniques, and don't forget that in next week you will have your control from all these mentioned topics. And please, please, don't avoid it. Show for yourself, first of all, that you are